Okay, so hi, I'm here with
Hello.
Swati Scott, who's actually in the beautiful province of British
Mhm.
Columbia in Canada. And Swati is a dietitian who has been working with pregnant families for a very long time, postpartum, and does amazing work. So, Swati, tell us a little bit about yourself.
Well, I embarked on this journey, I guess, when my kids were born. My daughters were born. So I've been at it for about 27 years, which is kind of how old they are. And when I entered dietetics, I've always wanted to work in public health. So as I went through my journey, I learned so much more than I had thought I had known in the perinatal nutrition world. So as I learned little bits here and there, I suddenly discovered the world of lactation and went through my personal journey, which I touched wood. Thank goodness I didn't have the stories I hear, but it just made me realize that there's such a lack of this information amongst my colleagues. We know that it's nice to do, but it's actually the how to do that's missing.
Mm,
And I don't know what it can be more foundational with nutrition than lactation.
yeah.
So I have been doing that for about close to 15, almost 20 years, just on the nutrition piece. I mean, the lactation part.
Mhm.
I became a lactation consultant. I passed my exam in 2012, then I recertified. And then I had a little bit of lag period there where I was in between jobs. So that kind of kept me away, but not really, because then I joined the board of BC Lactation Consultant
Yeah.
Association, and I tried to do things on the side because I was working with seniors at the time. And then I came full circle back. I currently work in a Healthiest Babies Possible program here in Vancouver, and it's all prenatal program. It's sort of like the WIC program, or like
Okay. Yes.
it's a fully embedded CPNP program, and is the only one of its kind in BC compared to the other programs. Many of these programs kind of are working on things like um, neighborhood programs, or NGOs that can't afford dietitians or nurses for that matter. I am a little bit puzzled, if I can say that, remembering very clearly when the announcement was made in Canada that we were going to have CPNP programs
Hmm.
some 25 years ago. But they've never put in any money into it. They've never, the funding has stayed the same for 25 years, which has deteriorated the quality of the program and access to key healthcare providers and professionals in the program.
Hmm.
So that's a real sad situation. And I think that we're missing out on that really fundamental foundational investment upstream. We keep talking upstream work,
Hmm.
but we're doing very little. So I get to do that now, and I
Wow.
also get to do a lot more lactation, and I get to support these young impressionable moms that I work with, parents that I work with, and help them to kind of navigate this field of feeding. Because I
Wow.
think as a community, as a society, we're not doing enough to give parents the boost that they need. And then we hear about the problems afterwards
Yeah.
when we
I
could have
can
fixed
I
it.
can hear the excitement in your voice, and that's just brilliant because that's what we want. We want,
Yeah.
people that actually love what they do because that's the way
Yes.
you pass the message around.
Yes. Yes.
And we all, we know in the field of dietetics, there's a strong influence from industry,
Totally.
and as you
Yes.
were saying, like a lot of these health professionals, they know breastfeeding's good,
Yeah.
um, but they forget that actually it's almost it's a public health imperative,
Oh,
right? And
totally.
they miss this part of it because,
Yes.
well, there's all these other reasons,
Yes.
and so often it's simply because they don't have the full information,
Yeah.
and so
And
yeah.
having gone through the lactation education, I realized what I was missing in my degree,
Mm,
right? And I had a few, those mentors that are planted somehow by the universe at the
yeah.
right time. And they're the ones who had big influence on me with this topic, with lactation stuff.
Yeah.
And then as you kind of unveil it more and more, and even if it's not prenatal or lactation education, nutrition stuff, the industry is so powerful. It is so pervasive, I'm going to say, and parasitic. Those are bad words, but that's what they are. And it's causing our healthcare system so much problem.
Yeah.
If we could take care of that, I think everything else could go back to the good old days.
Yeah, well, I think, and we are working, and Canada has a role to play.
Yes.
As it is a signature country to the International Code of Marketing of Western Substitutes, and all the subsequent resolutions that have come along from the World Health Assembly. So, it's as health professionals understanding that, we all have a role to play. So you're going to be doing some presentations with us over this next few weeks. And the first one that we're hoping to get recorded soon is called Prenatal Nutrition. Why does it matter? So give us a little snippet about what that might be about so we can tease some people.
Yeah. Well, I think we know what we need to have, but we also need to think about what might be the factors that come in the way. And I mean, you could call them barriers, but they're also things that maybe are affected by the mind that the parents are not able to process or think, or other barriers that come in. And I'm thinking of the social determinants of health.
Yes.
We talk about them in Canada. They're universal. World Health Organization has recognized that. And so we cannot underscore that enough. We can say you should eat well, but then what is getting in the way? And it's not always the individual. It could be, your income, your ability, where you live, isolation, all of those things. And then what you have coming with you. There could be disordered eating, trauma, and how is that affecting your ability to eat? But what I really like about the prenatal nutrition part is that it's the one time then a person is highly motivated because they know they're growing this new being in their body, that they want to actually go the extra mile if they can. And usually they 100% of the time want to do it. There could be other factors that are getting in the way, and they will be highly motivated to find whatever they need to do to get that good nutrition. Because they know what the outcomes are. They know that the outcome is directly related to the nutrition piece, along with everything else.
Yeah. And so basically, that you're at that way, improving health of both the fetus and the newborn to come, the parent that's pregnant, and generally if there's any other family members, because there's a change in a positive way of nutrition. It's an all-round change, which is really wonderful.
And what happens is that those parents who are having a second child or subsequent child, they know that.
Yeah.
They are even more motivated because they know that the first time some things didn't work.
Yeah.
They need to do things differently. Yeah. And they do it earlier and more with vigor, Yeah. And they're also looking after their little people that they have in their world, that they want them to have the best, but they're misled. They're misled by the industry. Yeah, I would like to change that if I could.
Okay. And so I think a little bit of the snippet might be that you might talk a little bit about what goes on with industry in your presentation. So that's going to be really fun to hear about.
And
we won't give them too much.
And embed this whole thing about why the WHO code matters. It's not just an inconvenience or anything like that. It's grounded. It is grounded in public health. Yeah. And we need to embrace it. We need to embrace that.
Practice. Yep. Yeah. Which is where we're all needing to go to. So I am so excited about this coming up. So if anyone is interested, be on the lookout for a presentation that Swati is going to be doing called Prenatal Nutrition. Why does it matter? Thanks, Swati.
That's good.